Hi, I'm Dr. Peter Ingoldsby.
And I'm Dr. Stephen Cudney.
And we are board certified oral and maxillofacial surgeons, and we went on askthepublic.com to find out your top questions about wisdom teeth. So let's get right to the top asked question: can wisdom teeth grow back?
Interesting question. So wisdom teeth are the most common extra tooth in the mouth. And while they can happen, they're typically not actually growing back. What usually happens is there'll be an additional tooth there that wasn't picked up on the initial imaging, which is why it's important to have comprehensive imaging from the get-go. And that's also a reason why, for the surgery, we might require a 3D x-ray to see the anatomy in the area, nerve, tooth positions, sinus positions, but also to see if there's might be an extra tooth or other pathology in that area.
So if my kid had their wisdom teeth out at 16, say, and then their dentist took an x-ray and they found a wisdom tooth in there, it's probably because they had an extra wisdom tooth, right?
Exactly. It did not grow back.
That makes sense.
All right, next up, can wisdom teeth cause headaches and ear pain?
Well, yeah, they can, especially top wisdom teeth. The top wisdom teeth are kind of right over here in the very back of the jaw, very close to the ear. And if you have a bad infection or something called pericoronitis around that area, it can radiate all the way to the ear. The other thing in our specialty that can sometimes cause ear pain is actually the jaw joint, which is just a little bit farther back. That is basically just a thin layer of bone between the jaw joint and the ear.
And let's not forget, ears also cause ear pain.
That's true. Probably if you have ear pain, the most likely cause is your ears.
Next up, are wisdom teeth useful?
Generally, no. The vast majority of people don't have room for their wisdom teeth. Only about 10 to 15% of people actually have a jaw big enough to allow full eruption of the wisdom teeth in a position that is maintainable, meaning you can actually clean it and floss around them and not develop cavities. Lots of times we're seeing cavities on people that are, say, 20 years old with wisdom teeth. Even if that cavity is small, that tooth's only been in their mouth a few years to already be developing
it's causing
cavity.
cavities in the tooth next to it, which is the biggest issue.
Yeah, the other thing is that they've looked at how people chew, and above 90% of your chewing efficiency happens first molar forward. So even an extra molar in front of the wisdom teeth. Most people, when they don't have wisdom teeth, they don't notice any difference in their chewing. Will my wisdom teeth straighten out?
They will not straighten out. So if wisdom teeth are coming in sideways, that usually only worsens with time. Now it's possible for there to be room, and as they grow and develop, they can come upright. But as you just mentioned, even when wisdom teeth can come in all the way straight, in less than 10% of the cases, is there enough room for that wisdom tooth to be there? And the big issue is that when you have a tooth that's partially in, you have gum tissue around it, you can't clean back there, you're more likely to develop gum infections and damage on the tooth in front of it from the bacterial inflammation and cavities.
Yeah, it's counterintuitive, but having a tooth half in, half out, so let's say you got 90% of the way there, you can see a little bit of the tooth, but there's still gum tissue over the back of it. That's actually probably the most dangerous way to have wisdom teeth. Bacteria easily get to the tooth. You can't really do anything about it.
Next up, what is a dry socket after wisdom teeth removal?
Good question. A dry socket, it's not just with wisdom teeth. It can happen with any tooth extraction. But a dry socket is a delayed healing where the normal process of how ideally we would get these to heal doesn't happen. So what is ideal? We get the tooth out, a blood clot forms within that hole where the tooth used to be, and that acts as a scaffold to grow new tissue. Fills in pretty quick in young, healthy people. In a dry socket, you lose that blood clot, and now you just have sort of this empty hole, and there's exposed raw bone in there, and until that bone gets some sort of coverage, it's really painful. When do you usually see those happening?
Usually about 3 to 5 days after surgery. And now there are several factors that we know cause an increased risk of dry socket. One factor is how long it takes the teeth to come out. So depending on the complexity of the wisdom teeth and the training of the surgeon, so if this is a board certified oral and maxillofacial surgeon, it's going to be the shortest possible procedure. Other factors include smoking. So nicotine causes the blood vessels to shrink up. We're more likely to have inflammation in the socket, and the blood clot comes out of that socket. You can also have increased estrogen, so people on hormone replacements, females, at a higher risk of dry socket.
Right. Luckily, dry socket is self-limiting. So what that means is even with no treatment, it should go on to fully heal without any complications. It's pretty painful though, and most of the time, if you have a dry socket, you will be calling your surgeon back because we're gonna tell you those first few days are the worst, and then it just gets better and better from there. With a dry socket, lots of times you'll actually feel okay and then get worse a few days later. Of course, a dry socket, that pain that you have could also be a true infection, so you would want to follow up with your surgeon, and we have some little tools that we can use to help ease those symptoms during that healing process. So next question, what happens if I leave my wisdom teeth in?
Well, if you are like most patients, there's not adequate room for those teeth to come in, chances are the tooth can stay partially impacted or fully impacted. That can lead to damage on the adjacent tooth. Less likely it can develop into pathology where you have cysts or tumors in the jaw. Again, that's less common, but we see that not infrequently at an oral maxillofacial surgery practice. Teeth that are partially in lead to more issues than not. And so if you are healthy, you're under the age of 26, that's usually the age where we see the complication of removing deeply impacted teeth outweighs the benefit of removal. We're going to recommend removal of most healthy and asymptomatic wisdom teeth if there's not a clear indication that that tooth will be able to fully come into the mouth and be in function with healthy gum tissue around it.
Right. You know, when we make this decision to take these teeth out, we are trying to look into the future and say, what's going to happen in the future? What are your chances? And of course, we don't have a crystal ball. We can't say for sure. But most of the time, if we have good imaging and a good exam, we can tell with reasonable certainty which teeth will cause problems and which teeth are unlikely. And when we weigh that against the very small risks of the procedure, I've got 4 kids. Based on what I know about wisdom teeth, all their wisdom teeth are coming out. How about your 3 kids?
I would agree, absolutely. All 3 of my kids, I would definitely recommend their teeth coming out. If there's clear indication that they are not coming in, which again, vast majority of cases, that is going to happen.
Did you have your wisdom teeth out?
I did, yes.
Yeah.
I actually had 2 of them. I was older. I was about 21 when it happened.
Okay. Yeah, I was 17, kind of typical
I wish I had been 17.
Well, that about sums it up for the top wisdom tooth questions that we found on askthepublic.com. That being said, you may have other questions that we didn't answer today.
And if you did, feel free to leave them in the comment section below, and we'd be happy to follow up with you.